So this is the Airway Metrics system that we'll be using to register Kim's bite registration. This has a vertical component as well as a horizontal component. We're going to start first with what's called the Snore Screener. And this is to determine if there's a vertical component. And this is 4 millimeters, the next step is 8 millimeters, and the next step is 12 millimeters of vertical height. So we're with our patient, Kim, and we're now going to start to focus on where we want the appliance set. So we have to determine some sort of vertical and horizontal component. And for determining the bite, we're going to be using the Airway Metrics system. And this is where it becomes very interactive with our patient and Kim. This is where it becomes a lot of fun. So you reported on your health history that you have some nasal issues, that you have a hard time breathing at night, and that you snore. Is that correct?
Yes.
Great. So Kim, we want to hear your best snore. Let's hear your best snore. Tammy, what do you think?
One more time, Kim. There you go.
There you go. So what you want to do is encourage your patient to give you their best snore. And that becomes the interactive component of doing the bite registration system. The first thing we want to do is determine if there is a vertical component to the bite. This is the Airway Metrics Snore Screener. You have different vertical components. The first step is 4 millimeters. The next step is 8 millimeters, and the last step is 12 millimeters. So let's start with 4 millimeters of vertical and see how that affects Kim's snore. So you're going to place the first step in between her maxillary and mandibular anterior teeth, and we'll have her snore. Let's give it a try, Kim. Go ahead and close. Give us your best snore. What do you think, Tammy?
I still hear a little bit.
Yeah, me too. So let's go to the next level, which would be 8 millimeters of vertical, and see what effect that has on Kim's snoring. Now for video purposes, I'm removing my hand so that you can see the snore screener in place. And then we'll have Kim snore. Don't ever let go of the snore screener while the patient is snoring, because the last thing you want to have happen is have them aspirate the piece. Go ahead and snore. What do you think, Tammy?
I heard more air.
Try it once more, Kim. Excellent, and open. Kim, did you feel like you got more air in?
Yes.
Okay, and that was comfortable?
Very comfortable.
Didn't hurt your jaw joint at all?
No, not at all.
Okay. So let's try and figure out our exact position. We now know that 8 millimeters of vertical is better than 4. Let's go to our Airway Metrics kit, and let's start at 6 millimeters of vertical. So that would be the middle row key. This is the 6 millimeter vertical key. And as you can see on here, we have edge to edge in the center, E over E, 4 millimeters of horizontal or 6 millimeters of horizontal. So I always like to go less is more, meaning I can always go edge to edge and all the appliances advance forward. So let's see what 6 millimeters of edge to edge sounds like. Close. For video purposes, I'm going to remove my hand so you can see the key in place. This is 6 millimeters of vertical edge to edge. I'm going to go back and hold the key. Go ahead and give us your best snore, Kim. We're still hearing some
Little bit.
Nasally constricted airflow. And open. So now we're going to add our secret weapon. We're going to add a nasal dilator called Mute by Rhinomed. So Tammy, why don't you and Kim work on sizing her nose for the proper Mute dilator size. So would you go ahead and do that with Kim, please?
Certainly.
Kim. I'm going to hand you the sizing guide and ask you to place it on the right side of your nostril. And it looks to be that the size small is the correct size for Kim.
So Tammy, would you like to hand us a small size? And Kim, we'd like you to try these and go ahead and put them in your nose. And let's see the response of the mute nasal dilator without any bite registration component in place. So Kim, go ahead and give us your best snore. What do you think, Tammy? It's better.
It is better.
It's better, right? Let's go back to the Airway Metrics system. Each one of the keys is set up appropriately at either 4 millimeters of vertical, 6 millimeters of vertical, 8 millimeters of vertical, 10 millimeters of vertical, or 12 millimeters of vertical. Then if you go horizontally, it goes from 2 millimeters of horizontal movement or protrusive all the way up to 7 millimeters of horizontal movement or protrusive. So we saw that Kim responded very well at 4 millimeters. Remember that the minimum thickness that you need for an oral appliance is 4 millimeters. That's why there's a 4 millimeter key. Let's start at 6 and see what happens with Kim. And I always start 6 edge to edge because less is more. I can always move my appliance forward. You can't move the appliance backwards. They all have some type of an advancement mechanism, and we'll look at that shortly. So here is 6 millimeters vertical. When we start to add more horizontal to our bite registration or protrusive, you need to make sure that the amount of movement forward or horizontal protrusive, that number faces the patient's throat. So we're going to add 2 millimeters of horizontal movement. So their maxillary anterior teeth will go in this notch. The 2 is going to face her throat. Her mandibular anterior teeth will come into the notch on the lower. Go ahead, Kim. Now once again, I'm going to take my fingers off the key for video purposes only so that you can see it more clearly. Don't have the patient inspire without holding the key due to aspiration. Seal your lips, Kim. Give us your best snore. I'm not hearing anything. Try again. And open. Let's add 3 millimeters of horizontal movement. So we're going to turn the key. The 3 has to face the patient's throat. Maxillary teeth in this notch. And she moves into, wait 1 second. Okay, go. Move forward. Good. Seal your lips. Snore. Not hearing anything. And open. Kim, how did that feel?
Great.
Did it feel like you got more air in?
Very much.
Did it feel that you got more in, especially since you have the mute nasal dilators in place?
Yes.
Easier to breathe through your nose?
Yes.
The word I like to use with the patients is the mute nasal dilators actually turbocharge their nose, if you will. So we've shown them that how important nasal breathing is as compared to mouth breathing, because if you look at the literature, we know that there are multiple articles that support the fact that if you're a mouth breather, it actually makes your sleep apnea, your OSA, worse. So we want to encourage nasal breathing to assist us in having our appliance do the best it can possibly do for the patient. Once again, less is more. You don't want to have so much vertical that the patient cannot get their lips together, because we want to ensure lip competence so that they are nasal breathers and not mouth breathers. So the question becomes, where do we set the bite? So what we found is Kim did better at 6 vertical, 2 or 3 horizontal, but we know that all the appliances can move approximately 5 millimeters forward. So I would like to have the latitude to be able to advance the appliance forward slowly. So we're going to start with 6 vertical edge to edge. So in this situation, it doesn't matter where the handle goes because edge to edge is edge to edge. So we're going to put the handle on the front part in that little slot. And then Tammy has painted the bite fork with some of the Panasil adhesive so that the putty is going to adhere to the bite fork. The reason I like putty is because it doesn't slump. Since we have a vertical component, I would like to have a nice thick bite registration. So my choice is the Panasil putty. We use all Kettenbach products in our practice for all impression materials. So we're going to show you today how we register the bite using the Panasil putty. So we now have our bite fork and our handle assembled. And Tammy, if you'd like to go ahead and start to mix the putty. She's going to take a scoop of each, the base and the catalyst. And you only need about half a scoop. You don't need a full scoop. And she will mix it up. And she'll start her timer. And I think we've all been to a state fair and had a corn dog. So Tammy is going to make us actually 2 corn dog pieces, and the putty will be the corn dog, and each side will be like the skewer of a corn dog. And you'll see how she places the putty over the bite fork. She's skewering it. And building it up. And like I said, this is why I like the putty over a mousse type bite registration material. Okay, our Panasil putty is now on our bite fork. We will seat the middle notch over her maxillary teeth, and her mandibular teeth will go into the bottom notch, and that will be edge to edge. Good, close back a little bit. Perfect. And you want to hold her chin, border mold the material in place with your fingers so you get nice contours. And we'll simply hold her chin so she doesn't open while the putty dries. Did you start the timer? So our timer has gone off. We want to verify that the putty is set, and it is. And Kim, go ahead and open. You're going to remove the assembly. The handle comes off, and that stays behind and is cold sterilized. The key comes off and stays behind and gets cold sterilized. Do not autoclave these pieces. They're made out of plastic. If you autoclave these, you will end up with a nice piece of melted plastic that will be a nice piece of artwork you can display on your cabinet. So cold sterilization only. Do not autoclave. And here is our index. So we have nice indentation of the maxillary teeth as well as the mandibular teeth. What we're going to do now is we're going to trim this and then reseat it in her mouth and verify that it fits and check her midlines. So you see we have a nice representation of the bite registration. The Panasil putty does an excellent job of doing that. But I'd like to trim this like we would with a crown and bridge impression. So we're going to take a Bard Parker 25 blade, and what you want is basically the only thing you want left in the index would be the cusp tips. So using the 25 blade, I'm trimming the Panasil putty back so that we have cusp tips left in our putty only. And then once I said, we will reseat this, verify the midlines, and we'll talk about the midline once we get it reseated. You can see it doesn't take a lot to trim this. And we have some nice representation of our cusp tips in here. Okay, so before you reposition your bite in place, I want to look at where her midline is because we want to have the proper midline represented. So if your patient has a 2 millimeter shift to the right, when they go in protrusive, you need to honor that 2 millimeter shift. Because the first thing the lab is going to do is they're going to call you and ask you if you want that honored, that midline shift honored. If not, they're going to set it to align the midlines properly. So Kim, go ahead and move your teeth forward edge to edge, bite together edge to edge. And you'll see that Kim has approximately a 3 millimeter shift to her right. And when we put our bite registration back in, we want to verify that. So I'm going to reseat this and verify that our midlines are properly aligned. Close together. And the beauty of the Airway Metrics system is this. Since this area is totally open, I can verify with my bite that her shift is 3 millimeters to her right. So we know that we have her in the correct position. The other beauty of this is we can now have her close, seal your lips together, and Kim, try and give us your best snore. You can see that the bite is set appropriately and that we have mitigated her snoring. So once again, it's great to try and verify that you have the right bite position, as well as verifying that they have no jaw joint discomfort. Kim, are you comfortable in that position?
Yeah.
Okay. If there's any question about that, you can always leave the bite in for 10 or 15 minutes, let the patient relax, and then come back and verify that they don't have any jaw joint discomfort. So we have taken a posterior bite on the right and left side. I'd now like to get an anterior stop. And what we're going to do now is we're going to take our futar D and we're going to register the bite in the anterior segment. And you want to express a little bit of the material out. Just stay together, Kim, and relax your lips. And we're going to simply place our futar D in the anterior areas. And this will provide a nice anterior stop so that the lab now has an anterior stop. And they'll get a better mount for their models. So we've verified that our futar D is completely set. And once again, the reason we do this is so we have an anterior stop to ensure that you have a proper mounting of your models in the laboratory. Go ahead and open, Kim. Great. And we'll simply remove it. And we can now see that we have anterior indentations so that we have that anterior stop to properly mount the models in the laboratory. So we found out the proper vertical and horizontal position for Kim's bite to mitigate her snoring using the Airway Metrics systems. We found out that she didn't have any TMJ problems and that the bite was comfortable. Is that correct,
Yes.
Kim?
Yes.
So we're now ready to proceed and once again send the bite registration to the laboratory of your choice for the fabrication of your choice of oral appliances. So Kim, we'll get you back in a few weeks and we'll get your appliance fit properly and adjusted. We'll show you how to clean it, make sure you're comfortable with it, show you how to use the bite exerciser, and most importantly, start to get you some better sleep. Sound like a plan?
Yes, thank you.
Thank you. I'd also like to thank Kettenbach for the sponsorship of this video of showing you how to use the Airway Metrics system. If you have any questions, please feel free to reach out to me. Thank you so much.